Hi Bob, I'm Erica. I'm just going to provide privacy here. I'm going to be your nurse today. Today we are going to be doing an assessment of your chest tube that you've had. Has someone ever done this assessment to you before? He says yes, because he's had this for a while, so he knows what's going on. Alright, can you verify your name and date of birth for me? And he does. And do you have any allergies, Bob? Says no, so I'm just going to raise his head a bit up here to more working height. So right away now, I just want you to know that I would keep a hemostat, a bottle of sterile water, and an extra occlusive dressing here in the room just in case I do have to change it. So now I'm going to take your vital signs like your blood pressure, temperature, pulse. I'm going to assess your respiratory rate, your oxygen saturation, and then I'm also going to be looking for any cyanosis, pursed lip breathing, or a cough. Then next I'm going to go ahead and put on my gloves, and I'm going to look at your dressing here. And as I'm doing that, I also want to listen to your lungs and listen for any crepitus that I hear. The crepitus is kind of like Rice Krispies, so that's kind of what the sound is that I'll be listening for. So, as I'm going to expose you a little bit here, actually I'll wait to put these on. I'm just going to kind of look at your dressing here. I don't notice any drainage right away, so I'm just going to probably reinforce the dressing instead of changing it completely. So now I'm going to go ahead and listen for any crepitus. Alright. And I'm not hearing any, but I'm also going to feel just in case, and I don't feel anything. So we're good there. So now I'm going to go ahead and inspect your tubing and your drainage system. So you have a dry system hooked up here, but if this was a wet system, I would watch for any titling because that is normal. But if there was any continuous bubbling, that would concern me for an air leak, but I don't notice anything right now. So then I'm going to come over here and assess the drainage that you have. I would use a Sharpie marker to mark where the drainage is with my name, date, and time. I would also want to check for the consistency and the color of the drainage. I would also make sure that the drainage system is always below the chest level. Then I would also want to make sure and assess how Bob does and how his discomfort is with any activity or without activity. And then I would also instruct Bob to practice cough and deep breathing exercises, as well as using his incentive spirometer every hour while awake. This way, then he can, be expanding his lungs and getting his respiratory, not his respiratory distress, but strengthen his lungs and everything. So now that that's all cleaned up, I would also make sure to modify this procedure. So like a child who is under the age of 2, they breathe with their abdomen, which is normal, but if I notice that in an adult patient like Bob, that would be concerning, but for a child, it's normal. Now, Bob, are you comfortable here? He says yes, so I'm going to lower him back down and give him his call light. Then I would also document the date, time, my assessment findings, the color and consistency of the drainage, I would also note how much drainage I saw. I would change the dressing if needed, but we did not need to today. And I would write down like how he tolerated everything that I did here today and document the date and time.